Welcome to Geriatric World. My name is Dr. Thomas. You can also call me Dr. T. I am a geriatrician who decided to create this channel, Geriatric World, because I think there is a forum that is very much needed for a place where people who are dealing with the challenges of mom and dad, uncles, aunts, brothers and sisters getting older, and how do you support them to be allow them to continue to function and also maintain their level of independence. So I'm hoping that this will be a channel where we can be able to discuss some of those challenges, but also be able to provide tips and ideas of how to help support families as they go through this process. First and foremost, what is a geriatrician? Geriatricians are physicians who, first of all, got their training in internal medicine and then or family medicine, and then decide to specialize further, specifically focusing on older adults. The next thing is also, how do we define an older adult? Essentially, an older adult is defined as someone who is 65 years and older. And there's not really a science to why that age was chosen. It was mainly chosen because it is at that age that most people qualify for Medicare. And so we definitely advise anyone who is 65 and older to consider going to see a geriatrician. The other thing also is, if you are having someone who's having memory issues, they do need to see a geriatrician, because a geriatrician can help assess and look at why that is going on and what are the things that can be done to maybe either slow down the process or even maybe sometimes reverse the process. And if not, how do you help support that person through that process? And how do you help support the family? So geriatricians practice principles that look at a older adult as a whole person. They are looking at how their diseases impact how they are able to function. Not only that, they are also taking into consideration what are the goals and what does the patient want. Because very often we find that what the medical goals we're trying to accomplish is very different from what the patient has in mind or what is important to the patient. So a geriatrician is able to take those goals and merge it together and create a plan that is more in line with what the patient wants. So I'm hoping to utilize Geriatric World, this channel, to be able to discuss topics that could come up, such as what is the difference between, which I get a lot, asked a lot, dementia, Alzheimer's, vascular dementia, frontotemporal dementia. How do I deal with my loved ones as they struggle with their memory in terms of managing their medications, their finances? How do we address diabetes in older adults? How do we address hypertension? How do we address issues when you're struggling with mom or dad still driving and you are worried about the fact that they're a danger to themselves on the road, but also to others? So those are some of the topics that I'm hoping to be able to address on this channel. So stay tuned.